everybody. Welcome. I'm Beth Dolan. I'm the Dean of the College of Health. Really excited that you joined us today to meet some Lehigh alumni who are working at the CDC. And they're really interesting. They had different paths into the CDC. And I'm excited for you guys to meet them and to ask questions. So just to give you a little bit of a kind of how this is going to unfold, a little agenda. I'm going to ask our panelists to introduce themselves quickly, and then we'll move into some questions that Jen Top actually elicited from students. And so I'll ask those questions. While I'm doing that, feel free to drop additional questions into the Q&A, and we'll just get to them, weave them in, or come back to them, or whatever. But as soon as it occurs to you, feel free to drop it in. It's not an interruption. It's actually great. You're participating in the conversation. And then after we talk through 5 or 6 questions, Emily Newman, who some of you guys might recognize, who graduated in 24, is going to give you some information and some slides about the program that she's in right now, the PubH Associates program. And then we'll have more time for a Q&A. So that's the plan. Let's go ahead and why don't you all introduce yourselves, starting with Angela, alphabetically, by your first name. And just tell us, if you don't mind, your name, your job title, and how long you've worked at CDC. And the rest of the story we can tease out as we go.
My name is Angela Han. I am a public health data analyst, and I have worked at the CDC for just over 2 years.
Great.
Hello, my name is Emily. I am a public health associate in the PHAPS program, and I've been with the CDC for 2 months.
I think I'm next. Hi, I'm Naomi David. I'm a public health advisor. I've been with CDC for, 9 years and 2 months, and I work in global influenza.
And I'm Rachel Kocher. I'm a health scientist in the Division of STD Prevention at CDC, and I've been with CDC for over 20 years.
That's great. So I love the range of tenure at CDC. That's something really fun to talk about. And everybody who's joined us as an attendee will also recognize Ben Moyer, our senior academic advisor, who's also joined us here. So here's a question, and just anybody jump in and you can all answer it, or if you don't want to answer one, that's fine too, whatever you want to do. So students want to know what a typical day at your job is like for each of you. It'll be different, right?
Well, I mean, I can jump in. My position is kind of, it's a little bit broader, so I end up doing a little bit of everything. So I do mostly behavioral science work, but that overlaps with epidemiology a little bit. I used to be able to analyze data, but unless you're practicing that skill, you're going to lose it. And then some health communications work. We do some, studies to inform the messages that we put out. And then working directly with programs where we give a lot of money out to the states, and then overseeing how they use that money to make sure that they're doing the activities they applied for funding to do.
That's great.
Yeah, I can go next. So I'd say my typical day is a lot of meetings with a mix of internal CDC, but most of my meetings are external with recipients that we fund. So I work a lot with different ministries of health from countries and WHO offices too. Thanks.
Really cool.
So I work at the National Center for Emerging and Zoonotic Infectious Diseases, and I work at the Division of Infectious Disease Readiness and Innovation, Epidemiology, Laboratory Capacity, and Informatics branch.
Wow.
So yeah, there's like divisions within larger centers. And so I'm on the data management team, and what we do is we administer the epidemiology and laboratory capacity cooperative agreement. And a cooperative agreement is how CDC, it's the mechanism by which CDC gives money to its recipients. So there's like 65 like partner programs, or not partner programs, but 65 like recipients in terms of like state and local health departments, as well as territorial health departments, that we give hundreds of millions of dollars too. And so I work with Salesforce and Excel and grant solutions to like work on ensuring that our recipients' funding needs are being met and providing any technical assistance to them that's needed.
Great.
So I'm in the Public Health Associate program. So while I'm not working directly with the CDC every single day, well, I do, but my main host site is actually in Albuquerque, New Mexico. So I work with the Albuquerque Area Indian Health Board doing school and adolescent health as my primary topic. 5 days a week, 8 to 4:30, 2 days telework. We primarily use Stata for statistics, a little bit of R, and SAS, and we kind of do survey implementation. We also have a lot of meetings with boards, external boards and partners. I work in a nonprofit that's Native owned, so we have 6 tribal leaders that we meet with once a month. And so yeah, there are a lot of meetings and a lot of data statistical analysis, and yeah.
It's great. And so can you guys each tell your story about your pathway from, let's say, undergrad to the CDC, and even your roles within CDC if you've changed roles? I mean, maybe if we start with Emily, because that would be the shortest, the shortest story. Yeah. Do you want to talk about how you found out about this and what the application process was like, that sort of stuff?
Yeah, definitely. And I'll go into it a little bit more later too when I talk a little bit more about the PHAP program. But my role, or how I found the program, was basically I met someone who also had done the PHAP program before, which stands for Public Health Associate Program. And the application process was very long. It was January to June, 3 stages. And kind of the more you get into it, the more specific you get about your background research and interests. And then while associates are applying for positions, host sites that are health departments or NGOs dealing with health also apply for associates through the CDC. So the CDC is kind of a mediator between the two. And at the end of the process, the associates that are selected are then matched with the host site. So yeah, in my role, I'm an associate, so I work with a CDC supervisor and a primary supervisor at my host site and a secondary supervisor at my host site. So it's kind of a training program where I also can get experience in the field, and I have specific completion tasks to graduate from PHAP eventually.
So who wants to go next? Jump in.
Yeah, so I graduated from Lehigh from undergrad in 2012. And then immediately following Lehigh, I did a year of AmeriCorps service in Chicago, where I worked in a food pantry and a Head Start preschool room, which was very different environments, but both fun. I would also put in a plug for AmeriCorps if anyone that's interested. It was a really great opportunity to, volunteer and do service for a year while I applied to grad school and figured out exactly what I wanted to do next. So after that, I went and got my MPH here in Atlanta, and then I joined the PHAP program that Emily was just describing. So I was actually placed in Tennessee, in Nashville, at the Tennessee Department of Health. So I was placed in a state health department working in foodborne illness. Sorry, I'm losing my voice a bit. Working in foodborne illness surveillance. It was a really great experience. I got to use my epi skills from grad school. And then following that program, I joined headquarters working in opioid overdose. So Angela was describing some of our cooperative agreements, which, as she said, is the way that CDC gets money out the door to our state health departments, other countries, really all levels of government and nonprofits throughout the world. So I worked primarily with states and local health departments. I then joined Global Tuberculosis Program, where I worked mostly with NGOs. And then in March, I switched positions and I'm now in the global influenza branch. So I work mostly with WHO regional and country offices, and then ministries of health in the countries that we fund directly. And so my regions are Europe and Western Africa.
And would you ever travel to those places as part of your work?
Yeah, I think 4 or 5 times a year I'll be slated to go on trips. So I joined in March and I've been on a few trips so far. We just got back from Ghana 2 weeks ago. Yeah, so it's great. We did 2 days of meeting with the partners that we fund, but then, while in country, we're in the capitals. So it's also a great chance to meet with the CDC country office, the WHO office that's based there. If there are other federal government offices, we try to make time for everybody, go to the embassy. And then we also put on a data analysis training, which I learned some things from. So it's great.
Oh, that's really neat. Yeah, great. Rachel, do you want to tell your story?
Sure, I'm the oldest, obviously, of the group. And so when I graduated from Lehigh, there were not undergrad public health programs. I had a degree in biology. And so I didn't know that public health existed. I just had read this book about an Ebola outbreak called the Hot Zone. And that's how I learned about CDC. And so I came down to Atlanta. And I don't actually, as we're talking, I'm thinking, how often do we hire undergrads now? I don't know, because at the time, you really could not get into CDC unless you had an advanced degree. So I went and got my master's at Emory, and then was hired on through an ORISE fellowship, which is another fellowship program that CDC takes advantage of. And so that's probably on the link that somebody's going to drop in the chat at some point. And through that, I got hired on permanently into the Division of STD Prevention, which I've been at in this division for the entire time. So I think as I'm listening to everybody's story, and Naomi, you're such a good example of this, there's such a breadth of opportunities within CDC, internationally, nationally, across every health topic you can think of, from laboratory to behavioral science. There's just so many different skill sets that are needed, and opportunities to move around and learn different skills and also different health topics. So for me, even though I've stayed in the Division of STD Prevention this entire time, I've been pulled into our outbreaks, like our Ebola outbreaks, our Zika outbreaks, Mpox, because there's a sexual transmission aspect to it. And talking about sex is a different skill set than, say, talking about something like influenza. And so you get to use your skills in so many different ways, essentially. So that's my short story.
Great. And can you say more, or maybe Angela could, about what is ORISE? Like, just describe it a bit more. I don't know, Angela, do you want to take that after you talk about your path, since you?
Yeah. Okay, so I graduated in 2017 from Lehigh, majored in health medicine and society and English. I think I was like the first person ever to major in health medicine society, because previously offered only as a minor. I had Dean Dolan, took medical humanities with Dean Dolan. And so this was right before the College of Health was stood up. Just right before it. So really missed that. It's very cool to see how public health has expanded at Lehigh. I then got my master's at public health at the University of Minnesota in policy and management. Then when I was graduating, I actually reached out to Naomi because I saw she worked at CDC. I was like, CDC is cool. And then I saw she went to Lehigh. I was like, oh, cool. And so she told me about these various opportunities for graduates. That's my cat. His name is Tyrion Lannister. Yeah, so, that was also one of my life goals, was just to get cats. Anyway, so accomplished that too. Then I did a health equity ORISE fellowship at CDC. One of the things I do like about that one is it doesn't have like this huge like long cycle of applications. It kind of has rolling admissions, so you can apply to it at any time, and there's always a position to apply to that you would be interested in. It's not an FTE. It might be contract. I think it's contract. So it might be a little harder to like get a permanent FTE since you're not already FTE and you can't apply to internal jobs. But it's also there for like 5 years. So you can do it for like up to 5 years and you would be renewed every single year. And you do have like a mentor I saw in the chat that someone else is interested in data. And I think that's another interesting thing, appealing thing about ORISE fellowships is that they can really be a range of topics and like a range of exposure, whether or not you want to be in policy or comms or data. So you can also specifically look for one that's in data. Another great fellowship to do if you're interested in data that you would need a master's degree and some years of experience to do would be the PHAPS fellowship. It's like the Public Health Informatics Fellowship Program. I don't know if you guys are gonna drop the links, but there are links to that too. And so, but I did mine in DEIA and health equity at the Office of Laboratory Science and Safety, focusing on what health equity looks in the context of laboratory science, as well as strengthening workforce development and DEIA for the staff there. It's actually since realigned to be OSR, the Office of Laboratory Systems and Response. And I did that for 2 years and just actually recently got my FTE as a public health data analyst at the National Center of Emerging Zoonotic and Infectious Diseases. So, yeah, so it was just so I was a ORISE fellow actually up until September and just recently got this position. And that's it. You're muted.
Yep, thanks. So to pick up on the question that you alluded to from Sana, so the question is, I'm interested in being a healthcare data analyst or biostatistician. What would be your tips to succeed in this career path? And how do I step into this career?
So something that there's like different skills that would be good to learn. One thing that might be good to learn is like Power BI. That's kind of how I got my FTE is like Power BI is pretty common at CDC in terms of using it to like make data visualizations. And then R, the coding R is really common. So I would say that's also a skill set that's common at CDC. And then it's good to learn other coding languages as well. But I think R and Power BI in specific are pretty commonly used at CDC.
Yeah. And Emily, you said that you also use SAS and Strata, right? Yeah.
But I know that Stata and SAS are used with the CDC because we work with them for our data, but that this is mostly what's used by my host site. So
Okay.
I have
Okay,
less
right.
of an understanding of exactly what goes on. Also, I don't think I mentioned I majored in population health at Lehigh, and so it was inaugural class of College of Health, which so you guys following are probably going to be less of guinea pigs, which I'm not saying in a bad way. It was awesome.
Well, yeah.
Um, yeah, and minored in molecular bio and environmental science. And also, is it okay if I respond to this question in the chat?
Yeah, definitely. So there's a question for you. Yeah. I'll read it. I'm really interested in the Public Health Associates program as well as an aspiring biostatistician. What tips would you give to successfully become a part of this program or possibly prepare for it?
Yeah, so first, I want to start by saying when you're in your application process, you can you can tell them of your interests in biostats because they ask you what your areas of interest are when you're applying for a host site. And so they're pretty good at matching, in my opinion. And so tips for successfully becoming part of this program or preparing for it. It's a pretty competitive program. And so I guess just showing your passion through your application. And in the first section so it's 3 stages. The first section is kind of just, I think it's the basics in usajobs.gov, giving your resume, and maybe a couple questions, but they also give you an optional opportunity to do a cover letter. And I'm not sure that people do it. And I would say do it if you can, because it might make you a little bit more distinctive from, I think about 2,000 people applied. So also, my email is also there, so I can give more of a response to that too. But yeah, kind of reaching out to PHAPS and yeah, trying to find a way to reach out to people to, in the CDC that you can to try to, yeah, get your name out there or see what's going on and just kind of coming across in your application as genuine and passionate and show why this program is so important to your path in exploration and biostatistics.
Emily, can I ask you a question, a follow-up question?
Yeah.
Did you have any like research or background experience that you could put in your resume when you were applying that you feel like added to your application?
Yeah, so I think something that I was kind of nervous about in my application was that I have little bits and pieces of research in multiple different areas, which can kind of come across as that I don't know exactly my path, but it can also come across as you're trying to explore and you're gonna get out there and you're a determined person. So I think it's good to just explore areas of research wherever you can and reach out to professors at Lehigh to see what's going on and see where you can get involved. I studied abroad in Barcelona, and when I was there, I worked with a psychologist that was working with health providers to train in cultural competency for healthcare providers who were working with child refugees, which was really interesting. And cultural humility is really important in the process of the application to the CDC. So if you can show your experience with that and mindfulness of that, then that can also prepare you well. I also did a little bit of research with Dr. Gomez in health policy and Dr. String in environmental engineering and water sanitation. And these were kind of just small projects. I wasn't in them for multiple years, but it's just about getting out there and showing that you're interested and working hard in whatever research opportunities you come across.
Yeah, that's great. And I did drop a link to the PHAP application, description for how you apply. And right now it still has the dates from last year up. So the one thing to really know is that the application window is open a week. So it's a really tight application window too. And I believe it generally happens in January. I don't know if the dates are out yet. Maybe, I don't know. It's not on this website anyway. But so you'll want to keep an eye on that and look for that week and just be ready if you're interested in this. And I guess I would want to add too, if I could, that this is open to, and correct me if I'm wrong, Emily and Naomi, but I believe it's open to people who have finished their undergraduate degree or their master's degree within 2 years. So I know we have some MPH students on the call, and we also have, students earning their bachelor's degrees. And it doesn't really matter what your major is. So certainly the majors in the College of Health are going to be relevant, I think. So, but I don't know, Naomi, you're the only person who hasn't revealed your undergraduate major. Will you share that with us?
Yeah, sure. I was psych and poli-sci, so I spent my college career gearing towards a different career, thinking I was going to go clinical psych route. But when I applied to PHAP, I did have an MPH, so I'd already gotten my degree in public health focus at that point. But yeah.
Yeah, that's great. So I wonder if, since we're on the topic of the PHAP, we want to switch to the slides that Emily's going to show us on that, and then come back to some of the questions that we have. And again, feel free to add questions in the Q&A. And then I still have questions that Jen elicited prior to starting here from folks. So, and Sana says, thank you, Angela and Emily. So Ben's going to put up some slides for us, Emily.
Okay, so I want to start out by saying these are CDC approved slides, and the CDC is very particular about what you can present to people in their name. So I didn't create these slides. They were given to me by my supervisor to present. And so I'm kind of gonna jump around and share my bits and pieces of experiences. But yeah, so the Public Health Associate program for recent grads, and yes, you have had to graduate within 2 years, either from an undergraduate or a graduate degree. But if you were military, then you have 6 years, if you came directly from military. And in my cohort, there was 25% military, which is the highest that
Wow.
it's been, which is kind of interesting. Yeah, there you go. Okay, so yeah, so the mission, this program is for recent graduates. about a little over 50% of my cohort had a master's degree, which I think is a little bit newer. There was about 46 PHAPS this year. And yeah, like what was said, you don't necessarily have to have a degree in public health, but you kind of have to show why this program is important to you because it is kind of competitive and focused on public health. It's kind of really a place for anyone to start in public health, getting field experience. So you don't have to know exactly what you're doing. You don't have to be a perfectionist in your craft. It's kind of meant for you to explore the areas of public health and get more experience. And your host site knows that you're not an expert. So yes, this is a 2-year program. It's paid usually GS5 or GS7 of the federal pay scale, which you can research online if you're interested. But there are adjustments for locality, so you could be placed across the US or in any US territory. There's little to no work experience required, like I said, hence entry level, which is also good because I know that when you're applying for jobs undergrad, it can be kind of daunting when a bunch of job applications ask for you to have prior experience and this is your first job, so you don't have prior experience, but this program is great for that because you get that work experience. You get a CDC supervisor, a host site primary and secondary supervisor, and you get a mentor who works at the CDC to support you in career development. So it's really supportive. Yeah, and so I work at a nonprofit. So there are NGOs, state, tribal, local, territorial health departments that can be your host site. So there's a plethora of different host sites that apply, even one in Hawaii. There's a placement in Hawaii for my cohort this year, and you can apply to Puerto Rico. Yeah, so it's pretty cool. You could go to the next slide. Yeah, so the competency domains. So the reason that these are important is because each item on the list is required in some tangible form. So your completion of required tasks is considered in mid-year and end of the year evaluations, and they're necessary to graduate from the program after 2 years. So when host sites are applying, which there are about 300 and only 46, well, there were 300 for my cohort and only 46 received PHAPS. They have to clearly state how you as an associate will achieve all of your necessary competencies. So it's competitive both ways, which is really good because you know you're going to a good host site. So for example, some of the requirements include analysis, data analysis, or formal write-ups of your work, or implementing and facilitating projects, or collecting and formally presenting data in some form, or there are also a lot of required trainings from the CDC. I'm ready for next slide. Okay, yeah, so basically you're not guaranteed a job with the CDC after this program, but it does help you with non-competitive applying. So after the PHAP program, you don't have to apply through USA Jobs again. There's a different CDC portal where you can work at any federal agency, maybe specifically within HHS, and also the CDC has job positions open. So you're kind of applying alongside your cohort for jobs. So it's much less competitive than just going through usajobs.gov. And yeah, so as I explained, you must have a minimum of a bachelor's degree and have done relatively well in school. And yeah. You can go next slide. So PHAP likes to emphasize that these are important characteristics of someone applying. So especially to the question of what can you do to look like a good applicant, really think about these things when you're constructing your responses to personal questions. Because if you can show that you're effective in all of these areas, then you're going to look like a better applicant. I would say in our orientation, which about 2 weeks ago, we went to the CDC headquarters for our orientation for the week, and the word flexible was used about 100 times because there are high expectations. You might be traveling for the CDC. Host sites are could be a very different environment than you're used to. I'm from Virginia and now I'm in Albuquerque, New Mexico. And then sometimes as a second year PHAP, you'll actually be deployed for outbreaks, which is really cool to help work on them. So there's some people deployed for TB or Marburg. So yeah, which is so kind of flexible in this way. Another way that you have to be flexible is that quick turnaround time. Like Dean Dolan was saying, you get about a week to apply. Well, you also get about 3 days to accept your job. Yeah, about 3 days to accept your job. So I opened my acceptance in June and then had 72 hours to tell them if I was willing to move across the US. And of course I was excited, but flexibility in that way too. Yeah, so I wanted to share these pictures because they're some of my closest friends at PHAP. Just kidding. I don't I don't know these people or have access to these videos. But I will say that in the in-person orientations at the beginning, middle, and end of PHAP, the administration works really hard to give you the opportunity to network and befriend your peers. And I've already met someone who's actually in Santa Fe and she moved from Maryland. So it's been really cool sharing and hearing about personal experiences amongst my cohort and kind of talking about our experience moving and in a new environment. So yeah. Oh, and also, so like I was saying, you can choose from a range of fields. So it was cool to also learn about the topic areas of different people because some people are in health policy, infectious disease, infant and maternal health, HIV/AIDS. Me personally, I wasn't sure. So I said, oh, I clicked a whole bunch of different topic areas and said, just put me anywhere because I don't care. But when you can choose your topic area, but you can also kind of choose where your top choices of location, and you can also kind of weigh what's more important to you. So Albuquerque was my second choice. So it wasn't that crazy to see that I was placed there. But some people stay close to home, which is also okay. And a lot of people get that too. So yeah. Oh yeah, and the phases. So first of all, I want to say in the application process, don't apply with your Lehigh email and make certain that your USA Jobs account that you apply through is a personal email that you're okay being emailed to until November when you receive your CDC email, because I used my Lehigh email and it was quite a process to make it my personal. So that's just a tip. So yeah, as I was saying, there's 3 phases of the application process. There's a Reddit if you're a little bit angsty and it's been a few months and you haven't heard back, but everybody kind of has different, it's kind of a different cycle for everybody. So some people might have heard that they got to the next level and you haven't heard yet, and that's okay, that happens. So first, the January application through USA Jobs, you probably give your transcript to show that you just recently graduated. And then, like I said, try to submit a cover letter if you can for the distinguished. And it might seem a little bit repetitive because in the second stage, you do personal statements, but I still think it can make you stand out a little bit to do that. And then the second phase is longer personal statements. And this might be when you write out your preferences and locations, which they ask you a couple times. But I recommend choosing specific preferences for your locations because I think it looks a little bit better to know kind of at least what you want to do and have a little background to support it. And the interview stage was really fun, which is the third stage, because it gives you a chance to kind of meet PHAP administration, sometimes depending on who's interviewing you. My interviewer was JT, which maybe you guys at CDC, maybe you know him. Theophilus, JT Theophilus. No, maybe not, but he's really nice. And he actually ended up leading our orientation, which was really cool. But they're all really kind people, and I think it's really important to show your genuinity through these interviews, because that really stands out. And then once you're in, it takes a while for the job to start. So I learned in June and didn't move out until October, because they do background checks and they reach out to your prior employers. So yeah, there's kind of that flexibility necessity. But yeah, that's all about PHAP, and I'll answer any questions, and I'll also send the PHAP website link in the chat.
That's great. Thanks, Emily. And we have one question, but I think you have answered it. So it's from an anonymous attendee. Do you get to indicate a preference for your host location, or is it completely random? And I think you've, I mean, I might follow up for them and just say, how many different locations were you allowed to rank?
So there were 5. You chose 5 preferences. Mine was first Colorado, 2 Albuquerque, 3 California, 4 DC, because I had to put my home in there somewhere, and then 5 anywhere. And so yeah,
That's great. And are they all domestic when you're listing locations? They're all in the United States.
they're all in the US or US territories.
Okay. Yeah.
Mhm.
Okay, that's great. Very helpful. And Naomi, would you add anything about that based on your own experience applying to PHAP?
Yeah, no, Emily did a fantastic job covering it. And of course, she's got the more recent experience. So I definitely defer to her on anything for application and the process. But that was really helpful to hear. Thank you for enlightening me on the PHAP Reddit. I can't wait to read it. But yeah, I think Emily also touched on a lot of great things that I want to echo, especially being, I guess, flexible was also the word when I was there. So they're still obviously using it, adaptable and flexible. When I got my placement, I had a phone call in the 72 hours to decide. I didn't even get my placement. I just got the city of Nashville. So didn't know if I was in a nonprofit, at the state, at the city. And they told me my topic, and I asked to instead switch to Georgia because I was already working somewhere that was getting a PHAP. And my supervisor called me and was like, no, it doesn't work like that, like Nashville or nothing. And I begrudgingly moved there, and it was a great 2 years. So just being open-minded to different experiences and topics in public health. So, yeah.
I would like to say one more thing too, just touching specifically for the seniors that are applying and graduation kind of comes up and you still don't know if you have a job. And that can be kind of nerve-wracking when a lot of your peers do know their next steps. And I think, I mean, a lot of what different PHAPs do is they'll be applying to jobs on the side or even apply to grad school and then push it off if they get it. But I just think that you should know that it's okay that you don't know exactly what you're doing next and be confident in your decision to go for this. Because, I mean, I was also applying to another job and kind of heard back and had to tell them that I had to tell them that the PHAP was my priority, even though I hadn't heard back yet from PHAP because I didn't want to end up changing my mind. And that was scary to at some point not have a job at all lined up. But it's sometimes it just takes that risk. So just it's okay if you don't know exactly what you're doing right outside of college. And that's important to know.
Yeah, that's
Like,
really helpful.
so I was gonna ask, Emily, do you remember what your time frame was for, I guess, having the interview? And then, so you mentioned hearing back in June. I think it was the same for me. But when was your interview?
I think it says on the slide the general time frame. Wait, it was in May because I remember I
Oh, wow.
had pictures for graduation later that day. So I was wearing all my regalia. Yeah. So it was in
Reassuring them that
May.
you're going to graduate.
It was really late.
Hilarious.
That's
I love
helpful.
that. So I think it would be really interesting to hear from you guys about so this is a student question. What kind of projects do you work on? And maybe there's one that stands out in your mind as something that you really enjoyed working on or that you're working on now. I don't know. Maybe Rachel, would you tell us about something that you've worked on that is interesting?
Yeah, I mean, one of the more recent things that I worked on that I found really interesting was with Mpox. So, we had this outbreak of formerly called monkeypox, and it was affecting disproportionately gay, bisexual, and other men who have sex with men. And one of the things that I don't think most people realize is the importance of testing your messages, and how particularly when it comes to sexually transmitted diseases and populations that have been discriminated against in the past. So we really didn't want to stigmatize certain groups because they were more impacted. And we often don't have funding to test our messages. We have to go with what we think is best. But we were able to get funding and hold focus groups with this really actually cool platform. It's an AI platform that uses natural language processing. So we were able to do these online focus groups that analyzes the data in real time. So it was able to thematically group responses for the qualitative data and run like basic statistics on the close-ended questions. So by the end of the an hour, we had we knew exactly why people didn't want to get vaccinated or what their questions were. And then we could develop messages that spoke directly to those concerns or questions, outstanding questions. And then we could go back and say, these are the messages we developed and these are the images we're going to put with it. How does this speak to you? And from that, we developed these great communication toolkits that we then sent out to the states and jurisdictions that they can use so they can preserve some of their funding and use it to maybe place the ads instead of having to create the ad. So that was one of those projects where it was more hands-on. Often, sometimes at CDC, we're a little bit removed from the work, but that was one of those opportunities where I could sit in and listen to focus groups and help build discussion guides and analyze the data.
It's great. It's really cool. Anybody else have a project they've worked on or are working on?
I can answer. Yeah, I would say that my job right now is definitely more high level than past jobs. So a lot of what I do, I'm not directly working in the field, but I am learning and helping facilitate the partners that we work with to do great things. Let's see, something interesting. So right now, I have multiple recipients that are working in conflict zones or active war zones, and then their direct work for testing or doing routine vaccination and surveillance is impacted. So it's been really interesting to work with them and then get WHO support too to figure out more innovative ways to collect data and get vaccines administered in the country for influenza. And a lot of that has also kind of expanded in some of the countries for where can we get our vaccines? How do we change the licensing processes to administer them in a pharmacy? Because previously everyone had to go to a doctor's office or a hospital or doing vaccination clinics. And it can be slow sometimes to see all the effort because when you're changing government policies, in any country, it takes a while. So we're starting to see a lot of those initiatives though that were started maybe a year ago take place before this flu season started. So, or for the Northern Hemisphere. So yeah, it's been exciting to see.
That's really neat. Yeah. So I like this question. What do you wish you'd known about your current career when you were in college?
I think, well, at one, I didn't know about public health because it was so long ago. But I think what I didn't realize, particularly about CDC, but public health in general, which we've kind of reiterated a bunch of times on this call, you really can come from any background. There's a need for everybody, and especially at CDC, we have healthcare providers, nurses, we have pharmacists, we have doctors, we have veterinarians, they do zoonotic stuff. We have English majors that we need editors, we have data people. So it really is this, I don't know, it's kind of like this, it takes a village really of varying backgrounds. And I think that's what is also super important in public health when you think about it from a diversity equity initiative or from a health equity perspective. You have to have diversity at the table in order to do the work well. And I think that's one of the things we really strive for at CDC is to make sure that we're centering that as in the work that we're doing.
That's great. Yeah, that's super helpful. Anybody else have something they wish they'd known about their career when you were in college?
I feel like I didn't know a lot. I guess one of the things that I didn't know when I was in college was I didn't know how to craft a federal resume or what a federal resume even was. So, it's a lot longer than a typical resume and you include specific things like the numbers of hours worked. So that would be a good skill to learn if you're interested in having a federal government career. Then you also have to like apply through USA Jobs. I don't know how many acronyms the federal government used, so I feel like I really didn't know a lot. And um, uh, I I like to Rachel's point, like it is so broad. So I think that was also something that I kind of like not like struggled with, but that was something I had to like work through. Is like, well, public health is so broad, so where my like narrow interests are, like am I interested in infectious disease and data? I think it's like good to like start thinking about more specifically like where you want to be fitting in within public health. And then also, even though everyone says this, when I was a student, I also didn't really understand like the concept of networking. Like I knew it like generally, but I didn't like fully understand what that would actually look like. And now that like I'm working, I kind of understand that like in terms of getting a job or like getting promoted, networking is like really important. And I think when I was a student, I was just like, oh, I need to get good grades and that's it. And I didn't really I didn't really fully like think about how you would be like strategically networking in order to like build your career.
That's great. Anybody else on that one?
Yeah, I can answer, and I might expand it a bit to say what I wish I knew in grad school instead. So I did always have an interest in CDC, and obviously I know this is a CDC panel, but I do just want to, put a plug in that there are so many fantastic public health careers and agencies to work with. And, the longer I'm at CDC, the more I'm interacting with different levels of government, NGOs, nonprofits. So definitely be open-minded because it's all valuable and helpful experience. And I don't know if this was mentioned earlier, but the whole point of the PHAP program is to take people and train them in the field and bring them to headquarters and build that capacity. So it is something that's really valued to have that diverse experience and working in different levels of government.
That's great. That's really, yeah. Emily, were you going to add something?
Yeah, and also, while it is good to have interests, a lot of people at CDC are also more generalists and have areas of interest all over. This was something that was first told to me at our orientation and was really interesting because I kind of thought that I was all over the place, not knowing exactly what I was interested in. But if you kind of know a little bit about everything and are kind of more interested in everything rather than one specific topic, that's okay too, and it can take you really far also. So
And I just want to add on the networking piece. I know I get cold emails all the time from random people who just want to talk about how I got into CDC. I think I could probably speak for all of us here that we are open to that. And sometimes it really is, to Angela's point, networking is important. And sometimes it's really just like the right person at the right time. I mean, that one of our one of our full-time employees she just happened to email us. I don't even know how she got our names, and she needed a work study position, and we happened to have one. And she was so fantastic, we hired her. I mean, it was just so. And then to Naomi's point, there's also not just CBOs, like community-based organizations and non-governmental organizations. There's tons of public health oriented foundations. And then we also give a lot of money to these private corporations that do public health work for us, like John Snow and I can't think of any more, Chickatelli. They're just like a bunch of, I'm sure Naomi, you can name a few too, but I worked for Northrop Grumman, and they were getting CDC, funds to do work too. So there is a broad spectrum of public health jobs out there that don't necessarily fall just in the government.
That's great. Yeah. So we have a question. When looking at CDC job applications, they describe GS grade level for experience levels. Is there any resource that could help explain more about what this means?
We can, I don't have one off the top of my head, but I know that our human resources has an idea in their head. Like the PhD cannot start, like if you have a master's, you have to start at a GS 11 or something like that when you're coming in cold. I think we had a PhD candidate or graduate, and they would not give her anything above a 12. I don't know what it is these days, but I think there is a definite, it's tied to it's mostly tied to your education. They do say years of experience. So you would have to prove like I have 15 years of experience, which is equivalent to like whatever they think it's equivalent to. So there is something I can look up and try to find it.
Yeah, I wonder if it's something that can be found by Googling or just really trolling around on the
Yeah.
job, or you dropped in the GS levels too. Maybe there's something connected to that. It's a good question. It seems a little opaque if you aren't in that world.
Yeah, for sure.
Yeah. Okay. Well, we just have 3 minutes left. So if there are any other questions, now is the time. And if not, I just want to invite, oops, we have a question. And then we have a contact slide that Ben's going to share with everybody's contact information so that I hope you heard Rachel's invitation, students to get in touch with everybody on the call who's at the CDC. And so we're going to share that information with you. But okay, so do other PHAPS collaborate with one another? If so, could you speak to how often or what those interactions look like?
Yeah, so PHAPS do collaborate with one another a lot. I mean, pretty informally too. So they're really social experiences. You meet officially the first time at the CDC headquarters for orientation. And then from there, they have a mixer where you go and network with CDC staff and also other students or associates in your cohort. I'm getting used to not saying students anymore. It's really weird. But yeah, so I met with a few PHAPs who are in Albuquerque a couple weeks ago just to go to a cafe and have breakfast together, and they're coming over later this week for a brunch potluck. So yeah, you get a lot of chances to interact. There's also a network council that helps you collaborate with other PHAPs all across the states, and they have different events. They had this one that was kind of like speed dating, 5 minutes in breakout rooms where you just talk about yourself and answer questions with PHAPs of year 1 and year 2. So they really try to create friendships out of the PHAP class because those are people who kind of understand what you're going through, and there might even be some PHAPs in your area that can help make the move more comfortable. So yeah, there's a lot of opportunities to connect.
That's kind of comforting, I think, to know that, that's a possibility, especially when you're leaving a college or grad school environment and taking the chance to going to Albuquerque, or Nashville. It's good to know that that's a possibility. So, well, we're at time, so I just want to thank all of you for participating, for coming to the panel as attendees, and especially to our panelists. It's great to see everybody and really appreciate what you're doing to help educate College of Health students about the opportunities with CDC. They're really exciting. Like, it does make me, personally think, oh, maybe I should have done that career path. Like, it's, it's great. I love what I do, but this is really amazing. So thank you so much. So you guys can see on the screen that we have some contact information here. Maybe you want to take a screenshot of it or a picture with your camera or something like that. Or a good old-fashioned pen and paper. We can leave it up for a second. I know we still have folks hanging on in the call.
I just want to say it's Gmail, not lehigh.edu, gmail.com.
Oh, yeah. So this one should be Gmail. It's really haunting you, isn't it? At the Lehigh. Sorry. Yeah. All right. Well, we're going to log off. So bye, guys. Great to see you. Thank you so much. And thanks for your help, Ben. And Kyle.
Thank you.
Okay. Oops, we have a question. Let's just see. Oh, just a thank you. So Maddie says, thank you so much for this presentation. Yeah.